Hi, my name is Brandy.
Nice to meet you, Brandy.
I am a occupational therapy grad student at Texas Women's University, and today we're wanting to perform the SAFE assessment. The full name for the SAFE assessment is the Screening Assessment for Falls Evaluation. So basically this is going to be kind of like an interview where I'm going to be looking for things that you tell me that may put you at risk for falls. And then at the end of this, we'll total up all of your risk and we'll see if there's anything that we can change or modify to decrease your risk for falls.
Okay.
Does that make sense?
It does.
Okay. Do you have any questions before we start?
No, it seems pretty straightforward.
Okay. Now tell me about your medical history. Do you have anything that's relevant?
Yes, I have Parkinson's. I was diagnosed in 1996. I started treatment in 1996.
Okay.
It's under reasonable control. It's just resulted in some difficulty with small movements, handwriting, speaking, as a matter of fact.
Okay.
And my large muscle groups are I get stiff. I don't shake.
Okay.
But my joints also get sore from the medication that I take.
Okay.
I have an artificial right hip
Okay.
and a shoulder that has a repair surgery on the left shoulder.
Left shoulder?
Shoulder, yes.
Okay. And you said you did have surgery on that left shoulder?
Yes.
Okay. So does that give you any problems now?
The shoulder does, it just gets sore if I sleep on it wrong, and the range of motion is a little bit less than I'd like.
Okay.
It doesn't affect my golf swing though.
Okay. Well, then that's a good thing, I guess.
It is.
Okay. Anything else as far as medical history, physical?
On my right hip, I mean, I used to do a lot of running, and that probably pounded my hip into submission.
Okay.
So I had it replaced in 2001.
That was a total hip replacement?
Yes.
2001.
It hasn't given me any trouble. It's just that the joint is weaker than it would normally be if it were not replaced.
Now, by weakness, do you...
Not enough strength to pull myself up. I need to assist myself by pushing with my arms, or...
I see.
I
Okay.
also have a bad right knee.
Okay, right knee. Any surgeries? Anything done on
I'm trying to avoid that at all costs.
Okay. Okay.
And I have spinal stenosis in my back, which gives me the back pain.
Okay.
Makes it difficult to stand for a long period of time.
Okay. Quite a lot going on there physically then, right?
Not bad.
Okay. So we have the right knee. Let's talk about your medications. What medications are you currently taking right now?
Mentidine,
Okay.
carbidopa,
Okay.
Comten,
Okay.
sledgeline,
Okay.
Flomax,
All right.
and let's see, what am I not? That should be two types of carbidopa. A time release and a 10-100 and a 5200.
Okay. Is that it?
That's it.
Okay. Have you ever received or are currently receiving physical therapy or occupational therapy or any sort of treatment for falls?
Not for falls.
Not for falls. Any PT or OT?
Yes, I had an OT for my hip replacement,
Okay.
and I had a PT for my shoulder.
So the OT was in 2001. And then
The PT was for my shoulder, and that was 1982.
okay. Alright. Do you use any sort of mobility aid, a cane, a walker, or anything like that?
I did when my knee. I had a problem with my knee, and it was just sore. I was on crutches for a while, and then I would work with a cane for a while while it was healing. That took about a month.
But nothing as far as an everyday use?
No.
Okay. Okay. Now we're going to talk about falls. Have you had any falls in the recent past?
Recently I fell when I was bowling,
How long ago was that?
2 weeks.
2 weeks ago. Now you said you were bowling. Did something get in your way? Was there some sort of obstacle or?
No, I think I picked up some water or fluid in my left shoe, and you slide with your left foot when you release the ball, and my left foot stuck, and it just forced me to fall forward.
Okay. All right. Any other falls?
Yes, I fell on the golf course.
How long ago was that?
That was last year.
Okay.
That was coming down a steep embankment. There was loose soil, and my right foot came out from underneath me, and I fell down on my butt and slid down the hill.
Okay, so you were coming down the hill, so
Yes.
it was a little uneven terrain.
Yes.
Okay. Any others?
Occasionally, when I go upstairs, I will not lift my right leg high enough, and I will clip the top of the step, and
Okay.
that causes me to fall forward.
So how often do you think that happens?
Oh, once a month.
Okay. Do you ever actually fall all the way to the ground, or do you just catch
You know,
yourself?
I catch myself either with my hand or just recover with my legs.
Okay. Still risky though, right?
It is.
Near falls, I guess that's what we would call that.
Near falls, when I walk the dogs, I wear Skechers, which are the shoes that have the round toe and the round heel. And the round toe, if I get my weight forward, causes me concern. I've not fallen, but I've come close.
Okay, and it's that you feel is due to the shoe.
Yeah, it has a rounded tip on it, so when you're leaning forward, there's nothing to stop you from applying pressure with your toes, so you just roll forward.
Gotcha. Okay. Okay. All right. I'm going to ask you a couple of medical questions. Do you feel any symptoms of dizziness?
I feel lightheaded in the morning if I get up real quickly.
Okay.
And that was due to the Flomax.
Okay.
I probably have, it lowers my blood pressure by about 5 to 10
Gotcha.
on the low end of the systolic.
Gotcha. And that's only in the morning?
Yep.
Okay. Do you feel any sort of fluctuation during the day in terms of functioning? Do you feel better at some times, worse than others?
It depends on if I take my medicine on time.
Now, medicine, you mean?
The carbidopa.
Okay.
And the count-10. The count-10 extends the effect of carbidopa, and if the carbidopa starts to wear off, I get stiff, my movements slow down, and it takes me about a half hour to recover after I take the medicine that I probably was late in taking.
Gotcha. Okay. Now, do you have any trouble managing your medications? Does anyone help you with that?
No, I've got a very nice container that is by daily and 4 doses a day, and let me show it to you.
So you do pretty well with this container then?
Yes, the best container I've had.
Okay.
It has the day on it, and it has the...
Okay. So this helps you keep track of what you've taken
Yes.
throughout the day. Report any falls to me or near falls of unknown cause. I know we've talked about some falls and you feel that you had reasons for those. Any falls that just can't really explain why you may have fallen?
No, I've never fallen that I could recall that I didn't know what it was due to.
Okay. Do you ever have any unsteadiness whenever you first stand up?
Yes, in the mornings because of the low blood pressure and lightheadedness, but
Gotcha.
with the Parkinson's, when you make sharp turns, either with your big muscles, you tend to cut the quarters. These right here, these gouges on my leg right here came from the side of the bed, where I was trying to cut the corner and didn't put my leg far enough away from it, and it clipped it. So the stability is definitely medicine related.
Gotcha. Okay. Okay. Now we're going to talk about your balance and your gait. You don't use a mobility aid
No.
right now, so that doesn't really refer to you. Do you ever feel like you sway when you walk?
Yes.
Okay. Do you have any weakness or reduced sensation in one leg?
Occasionally from my back, from the stenosis, I'll get a pain that shoots down my leg.
Okay. Do you ever trip when you walk, when there's no obstacles in your way?
Only in the cracks in the sidewalk.
Okay. Then that was a yes. All right.
That's the same. That's about the same reason when I miss steps, I'm just not picking my feet up enough to clear the crack.
Okay. So the crack in the sidewalk.
Uneven ground.
Okay. Okay, we talked about your shoes, but do you have any ill-fitting or unsupportive footwear? Or do your feet ever hurt from the shoes that you're wearing?
No, they don't.
Okay. As far as your vision, do you have any difficulty seeing steps or obstacles around your house?
When I first wore my trifocals that are blended, going downstairs was difficult because when you look down, the blending you come out of focus. But after you get used to it, I probably don't look down as much as I should or up as much as I should, but I'm fairly stable.
Okay, so you've accommodated to your
Yes.
glasses. Okay. Do you ever walk in dim light?
I try to avoid it. I don't want to get mugged.
Even around the house, though, I mean, do you try to keep everything pretty well lit?
Probably not as well as I should up in the hallway going to the office.
Okay. Have you had a vision assessment in the last 12 months?
Yes.
Do you feel like you have any safety issues or concerns regarding falls?
I know it's a big problem in the hospital environment, and my business is in safety, so I'm familiar with some of the problems.
Okay.
And I try to avoid putting myself in those circumstances where it would be an issue.
So with you yourself, do you feel like you have any concerns about yourself falling?
No, I pretty much what I'm doing is try to maintain the center of gravity
Okay.
within limits.
Okay. As far as nutrition, do you have any unexplained weight loss?
No, I don't explain weight gain,
Okay.
which probably isn't doing my back any good.
Unexplained? You mean just...
No, I can explain it.
Okay.
I eat too much and don't get a chance to exercise because of my back.
Okay, I understand. How's your appetite?
Too good.
Okay. Do you have any difficulty following instructions or any confusion?
No, it's frustrating with the Parkinson's and speaking. What runs through my head is not as easily translated to my vocal cords as it used to be.
Okay. How are you monitoring your own safety?
How am I monitoring my own safety?
Do you feel you do a good job at that?
Probably with VVM, Verbalize, Verify, and Monitor, which is my business. If you see a risk or a hazard that's there, you pay attention to it. In fact, if you're alone, if you talk to yourself and just point it out to yourself, then you can have a chance to verify that it's an object and to take care of how you proceed around it.
So you're pretty knowledgeable about monitoring your own safety.
Yes, and I need to do a better job with the bed, corner of the bed.
At least you're aware of that, though.
Yes.
Okay. Do you have any problems going to the bathroom, any urgency, accidents, anything like that?
No, the full max takes care of that.
Okay. Do you have a fear of falling? Do you restrict yourself to any activities for fear of falling?
I restrict my golf swing, which is a good thing. It keeps you from falling over from swinging a golf club.
Okay.
But I'm very aware when I bowl or when I'm doing anything that, even walking the dogs, that if I get tired or my back gets sore, I stand a chance of coming closer to having a fall.
Okay. As far as medications, we reviewed those. This asks if you take 2 or more of the following. On here is Parkinson's disease drugs, so we'll check you guys for that.
Okay.
Okay. Now we're going to talk some about your environment. As far as indoors in your home, do you feel like there are any hazards related to falls? This could be cluttered rooms or rugs, cords draped across a walkway, anything to that effect.
In the garage, I have a work area, and it's plenty full of materials, and I have to be careful when I maneuver that environment.
Okay. Okay. Outdoor hazards, uneven ground or any obstacles?
Yes, there's a raised patio where I have a putting green in the back, and if I step on the flagstones the wrong way, that's an issue.
Definitely uneven.
I have a step there that they use. If the dogs get rambunctious, they'll cause me to rebuild it.
Okay. Okay.
But it's definitely an issue.
Okay. And that's guessing in your backyard or something?
Right.
Okay. All right. Do you have any restricted traffic ways indoors? Any doorways that may be
Only when I'm carrying the laundry out from the bathroom, from the laundry hamper.
Okay.
The doorway is narrower than the basket width or length.
Gotcha.
So I have to,
so it's related to those chores specifically.
Right.
Okay. How about the lighting, indoors and outdoors? Do you feel like it's sufficient?
yes, I do.
Okay. Do you have any difficulty climbing the steps to the house? Obviously, we talked about when you wear those Skechers shoes, but is that really at any time, regardless of the shoe?
Anytime, regardless of the shoe.
Okay. Do you have any difficulty getting in and out of bed, on and off of a chair, the toilet, or
Yes.
in and out of the shower?
The bed.
Okay.
I have a hard time rolling over position-wise in bed if I don't have something to grab onto because of my back, because the Parkinson's.
Okay. What about up and down from a chair? You mentioned pushing.
Yeah, it depends if it's slanted backwards, where it's an uphill stand, then it's going to be more difficult for me to get up.
Gotcha. Toilet?
No.
Okay. What about in and out of the shower?
There's a lip on the shower that I'm very careful to plant my feet and make sure they're dry, something dry before I step.
Okay. All right. Now let's talk about some of the things you do on a day-to-day basis. Do you have anything that you feel you are unsafe doing on a day-to-day basis?
Day-to-day basis. Walking the dogs if there are other dogs around.
Okay.
They're small, but they're strong.
I understand. Okay. Is that it?
That's about it. I mean, otherwise, I'm pretty much in control of my environment.
Okay, good. Do you have any difficulty reaching for items, carrying items, bending down to grab an item?
Yeah, bending down to grab an item, I've used my little pincers that I received from the OT when I had my hip replaced.
And that still helps you today?
Yes, it does.
Okay.
As does the long shoehorn.
As far as carrying items, you're okay with that?
Right.
Okay. Do you feel unsteady when you're turning quickly or rushing?
Yes, so I don't.
Okay. Do you find it difficult to stand and safely wash your hair, shower, dress yourself?
No.
Which ones do you not feel safe doing?
No, I feel safe doing all of them.
Oh, okay. So washing your hair is fine, showering, dressing yourself is all
Right.
fine. Okay. Do you have trouble getting off the floor?
Yes, I can't directly sit up and stand up. I have to roll over and do a push-up to a kneeling position and then stand.
Okay. Do you ever leave your house more than once a week?
Yes. Every day.
Do you walk less than 5 times a week for at least 15 minutes?
No. I walk about a mile and a half to 3 miles every day with the dogs. Or at least 5 days. At least 5 days a week.
Okay. Do you participate in tasks that appear dangerous for your level of ability?
I try to avoid that.
Okay. Do you have any assistance for personal care? Does anyone help you shower, shave, dress, bathe, anything like that?
No.
Okay. Do you have anyone supervise you for mobility or any particular activity?
No.
Do you have any current home services, home health, or?
No.
All right. Well, I'm going to tally up your score and then we'll go over it and look at what your risks for falls are and what areas and see what maybe we can do to help that.
Great.
Okay? Thank you
Thanks.
for participating.
Thank you.
All right. Hi, my name is Brandy.
Nice to meet you,
Nice
Brandy.
to meet you, and your name is?
Kathy.
Finished up an assessment with your husband, Bruce, and we were reviewing his risk for falls for doing the screening assessment for falls evaluation. That's the formal name of it. It's also known as SAFE. It's just the acronym. What I'd like to do with you is go over the list of questions, the same questions that I asked him, just to make sure that there isn't anything that I may have missed or that maybe there's some discrepancy between his opinion and your opinion about overall environment, his abilities to do things, and things like that.
Okay.
So we talked about his medical history, and if you could tell me a little bit about his past medical history, anything relevant to falls.
Parkinson's.
Okay. He did mention that, and he's on medications for this?
Yes, he is.
Okay, what are those medications?
Too many.
Too many, okay.
Too many.
He gave me a list.
Okay, he would know that better than
Okay,
me.
okay, good. Had he had any current or previous services for physical therapy, occupational therapy, or any therapy related to falls?
No.
Okay. Does he use any mobility aid, a cane, a walker, anything?
No.
Okay. Has he had any falls that you know of in recent history?
No.
Okay. All right. I'm going to ask you a couple of questions about his medical history. Some you may not know. Do you know of any dizziness that he may have?
No.
Do you notice that his ability to function fluctuates during the day?
Yes.
Okay. Can you explain that?
He would just get a little stiffer, or his back really bothers him.
Okay. Now, is that any one time of the day, or
No.
just fluctuates?
Yes.
Okay. Does he have any problems managing his medications?
No.
Does he have any falls or near falls of unknown cause?
No.
Is he ever unsteady when he first stands?
I would say a little.
Okay, can you explain that?
Just maybe moving in the morning, or, you know, when he's first getting up.
Okay. He doesn't have a mobility aid, so that doesn't really apply to him. Does he sway when he walks?
Does he sway? No.
or furniture walk, maybe rely on the furniture?
Yes.
Yes. Does he complain of weakness or reduced sensation in one leg or the other?
No, not really.
Okay. Does he complain of tripping when he walks, even when there's no obstacles in his way?
Sure, yeah.
Does he have any ill-fitting or unsupportive footwear?
No.
His feet never hurt or anything like that?
No.
His vision, does he have difficulty seeing the steps or obstacles around the house
I don't think so.
related to his vision?
No.
Does he walk in dim light? Or does he always try to keep it well lit where he's going?
Oh, no. No. He'd walk in dim light.
Oh, he will walk in
Yes.
dim light. Okay. Okay, has he had a vision assessment within the last 12 months?
Yeah.
Do you feel that he lacks insight into general safety or his own concern for falls?
Does he like insight? No, not really. No.
Has he had any unexplained weight loss?
No.
Poor appetite?
No.
He said the same. Does he have any difficulty following instructions, or does he have any confusion?
Driving, yes.
Okay. Driving.
He's a man.
Driving instructions. That anything other than that?
No.
As far as monitoring his own safety, do you feel he does a good job at that?
Yes.
Okay. Does he have any problems with urgency or accidents going to the bathroom, urination?
No.
Okay. Do you feel like he has a fear of falling, or does he restrict any of his activities
Yes.
related to falling?
Yes.
Okay. Can you go into detail about what he may not do?
Oh, well, like riding a bike or
Okay.
play tennis or, those kind of things.
Okay. Now this question about medications, it asks if he takes 2 or more of the following, and in here is Parkinson's disease drugs, so we're gonna go ahead and mark him yes for that.
Okay.
As far as his environment, do you feel that there are any indoor hazards present? And this could be a cluttered room, a rug, or a cord, maybe in a walkway, that would pose a risk.
Oh, sure. We have clutter.
Okay. Clutter.
His office is a risk.
Yes. Okay. What about outdoor hazards? Uneven ground or obstacles outside that he frequently walks, maybe in the yard?
There could be, yeah.
Are there any restricted traffic ways indoors? Any doorways that
No.
maybe? What about lighting, indoors and outdoors? Is it sufficient?
Yes.
Any difficulty climbing steps to the house?
No.
Does he have difficulty getting in and out of bed?
Yes.
Up and down from a chair?
Yes.
Toilet?
Pardon me?
The toilet? Up and down off the
No.
toilet? What about in and out of the shower?
No.
All right, in terms of what he does on a day-to-day basis, does he perform his activities of daily living or showering, getting dressed, all of that safely?
Yes.
Okay. Does he have any problems reaching for or carrying items, bending down to pick something up?
Maybe bending down, picking.
Is he unsteady when he rushes or turns quickly?
No.
Does he have difficulty standing and safely washing his hair,
Yes.
showering?
Oh, I mean,
He does that safely.
he does that safely,
Okay.
sorry.
That's okay. So does he have any problem showering safely?
No.
Dressing himself? Unable to get up off the floor? He is
Difficult.
Difficult, okay. Does he leave the residence less than one time a week?
Does he leave less? No, he leaves
Every day?
frequently. Let me say not enough.
Does he walk more than 5 times a week for at least 15 minutes?
Well, let's say yes.
Okay. Does he participate in any task that appear dangerous for his level of ability? Does he do anything that you feel that he might not be able to do, but he still does anyway?
No.
Okay. Does he have any assistance for personal care, showering?
No.
Does he receive supervision for mobility or for any activity?
No.
Any home services? Home health, gardening? Okay. All right. Thank you for completing this with me, and I'm going to compare yours and his interview, and then we'll tally up the results and
Okay.
interpret all that for you guys.
Okay, well,
Okay.
thank you.
Thank you. So I've looked over both of your individual assessments regarding your risk Bruce for falls, and I've noted some areas that may be a cause for concern. Out of the total score, there are 38 questions on the assessment, and 16 areas showed a potential risk for falls. Some of which we can't really do a whole lot about, one being your medications and the Parkinson's, but there are things that you can do to compensate for other areas. One that we make mention of is the stairs and then the outdoor hazards. We talked about your morning dizziness. Obviously, that's a concern for falls. Your inability to stand from a chair or get out of bed. All of those are target areas that I think that we could focus on in an occupational therapy setting. So those are things that we would like to target in session. And then some things that you can do on your own to reduce your risk of falls. Maybe to unclutter the garage, organize it in a way that you can freely move about in the garage without any sort of obstruction or anything in your way.
Mm-hmm.
Also, what may be good in the future is putting railings up on both sides of the stairs to help you get up and down the stairs with ease. And then also shower rails to help yourself turn and maneuver in the shower. So those are our main points of focus from this assessment. Do you guys have any questions about any of the results or any one particular area?
No, it's made me more aware of the whole picture of protecting against falls.
Okay, good. And one thing that I would like to identify as a strength of yours is that you are very aware of your environment and you're very aware of safety as a whole. You have good insight to that, so I would like to encourage you to continue to be aware and maintain that level of insight so that you don't pose more of a risk for falls.
Okay.
Okay?
Thank you.
All right, thank you guys.